Welcome to Thrive While Living an Addict. I want to just say we have an amazing guest on today, Dr. Rais Vohra, who is an emergency room physician, is a medical toxicology expert, deals with and is at the forefront and leading edge of addiction toxicology and the movement to get Narcan out there so people can save people when they overdose, and so many other things. And so we are going to talk today about some very important things during the holidays. One is, how do you prep for if your loved one shows up and they are inebriated or high? And how do you prepare for that? Also, making sure that you have Narcan in your home. And how do you navigate an emergency room visit if, in fact, that's what is called for, either as a friend or a family member? What do you do when you have an accident or you have a surgery that you have to have and you are in recovery? Some really hot topics today, along with trends as to what's happening at the forefront of dealing with addiction. So hang on to your seats and welcome. So welcome to Thrive While Loving an Addict. We are super blessed to have back with us Dr. Rais Vohra, and he is a change maker in the medical community, emergency room physician, a medical toxicologist, in charge of so many things in the Fresno, California area, moving things along in a proactive, compassionate, and informed way relative to substance use disorder. So I wanted to have him back because we're kind of in the throes of the holidays, which is kind of Thanksgiving to Super Bowl is a prime time for relapses and craziness and chaos and all of these things. And so I wanted to bring him back to talk to our audience about how do we navigate if there's a relapse? How do we navigate if there's an accident and your person has been in recovery and they have to go to the hospital? So there's a number of topics we're going to hit today that I believe are going to be super valuable for our audience. And thanks for joining us, Rais.
Thank you. Thank you for having me, and happy holidays.
Absolutely. So let's start with preparing for the craziness and what if.
Yeah, this is a chaotic time. No matter what else you have going on in your life, this is the holiday season. It just seems like December just rushes by for all of us. And there's a lot of disruption in people's daily routines, as they're preparing for family get-togethers and work holidays, and obviously whatever kind of shopping and preparations they need to do just for this season. I think all of those can add additional stress. And at the same time, there may be additional temptations as well. People are taking trips. People are just exposed to things that throughout the year they may be very well protected against. So, that's a great question. How do you prepare for a crisis during the holidays? Obviously we don't want it to happen to anyone. It should be a joyful season, and hopefully it is for everyone that's watching and listening. But we all have people in our lives that are at risk. So it's important to really think ahead to say, what are we going to do whenever, unfortunately, that phone call comes, or whenever I have that conversation and I realize that, okay, we need to do an intervention now in the middle of this holiday. So hopefully we can give people tips to prepare, whether that's doing bystander Narcan, which I could talk about if you want.
Absolutely.
Or preparing to have an ER visit that's always unscheduled and always stressful. But these are the things that when you think about them and reflect on them, being prepared, I just can't say enough about just how important that is, especially if you're supporting someone vulnerable and at risk.
I would love you to touch on those because, honestly, just in the last 3 days, I've had 5 different execs that have various family members that they're dealing with, and it's just happening.
Yeah. And, in some ways, I always look for the silver lining. People want to make changes in the new year, as superstitious as that is. New Year's resolutions carry a lot of value and currency in our society. So I think people do sit down to reflect and say, we're here at the end of one year and at the start of another. What can I do differently, and what can I do to help myself, help my family? We can leverage that as an opportunity. We can, as hard as those conversations are, we can turn that into, hey, let's do something positive, whether it's healthier eating and healthier habits, or, seeking out that medical intervention or behavior intervention that really is going to deliver someone out of a life that's really going in the wrong direction. So in some ways, there is a silver lining to that. But before you get to that silver lining, you may have to go through some really hard stuff.
Right.
So I guess the easiest one to talk about is Narcan. Hopefully that's not a new word for anyone listening out there. Narcan, also known as naloxone, is a life-saving antidote. I see it save lives every day. I'm about to go into work that's why I'm in my ER scrubs today. I'm about to go into work in the emergency department, and I see it every day. People who get bystander Narcan, certainly our EMS providers and even our law enforcement officers, to their credit, have taken it upon themselves to really learn how to use the Narcan and carry it at all times. And I think more and more school churches and, civic organizations and retail centers and employers, I'm getting so many requests to talk about and educate people around naloxone. I see it as a positive sign. And you've heard me talk about how it's an incomplete reaction to what needs to happen, but it's a really important component of the overall reaction. So naloxone, find the nose and save a life. That's my 2-second Narcan training for you. Find the nose, squirt the stuff in the nose, and call 911. And hopefully by that time, your loved one will still be alive and breathing. And if they're not, you can redose it. The Narcan boxes that we distribute have 2 doses inside them, and they're all intranasal. That's 90% of what's being distributed out there. There's also intramuscular, which involves needles. A lot of people are nervous around needles, understandably so. For the most part, find the nose and save a life. Get Narcan. There's so many different ways to get Narcan. If you're in my area, you can go to any one of my hospitals. You can call my health department. If you're in California, the California Department of Public Health has a really nice website. And really all over the country and hopefully wherever it's needed, you're able to find a local group that's doing naloxone distribution, education, and you have access to it. It's now FDA approved for over-the-counter, retail sales. So you can even go to your local pharmacy and just pay out of pocket just to have it on your person. But it's widely available and widely supported as a really good first aid for overdose. So know how to get Narcan. Remember, know how to use it. It's going to go squirt in the nose, and the person can't give it to themselves. So really a loved one and all of their friend circle, their support network is going to have to be involved and engaged so they understand, listen, I'm going to know where this stuff is kept in your house. And I'm going to know how to give it to you, or I'm going to keep it with me in my purse or my backpack just in case we need to get, and if you're at a party, just think about all of the places that you're going to be this holiday season. You may be in a public place, a bus station, a train station. You may be at a party. You may be at a shopping center, at a neighborhood park. All of these places are places where naloxone is probably very useful to carry just in case. So I think that that's kind of the low-hanging fruit. That's how we're going to save lives this winter, is if more and more people are comfortable giving Narcan, they have access to it. And if we just get the community talking around this life-saving intervention.
Super. I'm a big fan. And I just want to give an exclamation point to have it in your home.
Yeah. And what's interesting is, we have this conversation with our patients that are at risk all the time. So it's almost automatic for us. And for several years there, I really struggled with, am I reaching the right people? There's some people that seek it out and want it, but they're not the ones at risk. They've just read about it and they're kind of that anxious personality that just wants to be overly prepared, and that's fine. But it's like, is that really, I'm not reaching the people that aren't even coming into my ER and are, for whatever reason, just not able to access medical care. So for a long time, I really struggled with that. And I still do, because I know that there's a lot of people that need Narcan that don't have access to it. So we always try to push ourselves to say, where else do we need to be? We're talking to our city buses, because we want all of our bus drivers to be educated. think about how much a bus driver sees in the life
Oh my
of the
goodness.
city. Think about how much of a nerve center they are in the life of a city. And every city at this point, has this issue. So it's like all of the bus drivers should just be educated in how to do it. I don't want them to become paramedic, but they should at least be educated in this bystander intervention that we know saves lives. Now, it turns out that just having Narcan, like on the bookshelf, on that beautiful dresser behind you, is having it in the house and in the room does something to that person's mind and does something to that person's social dynamic to where they do better. And there's now evidence coming out that even if the Narcan never comes out of its box, it does something to really just change the circuits. And you're looking at it every day. It's in your peripheral vision. You've had a couple of conversations with a provider about it. All of those, I think, really get these gears in motion to where people then start to change their lives into hopefully healthier habits. And so even unused Narcan saves lives.
Yeah.
Which is, I know it sounds crazy. Even as I say it out loud, I'm like, that's crazy. But that's kind of what the evidence shows, is that just having it, as a conversation piece and to say, yes, I keep Narcan on my dresser because I have someone that I love and that, and that I walk these streets and I know what this problem is. And I think just confronting it in that way.
Right.
And that's why I love, talking with school groups and civic groups and employers, because I feel like even if they themselves aren't the direct beneficiaries, they're part of this larger conversation that we need to have as a society.
Yeah.
So that's why Narcan, I call it the gateway antidote. We talk about gateway drugs. This is the gateway antidote. This starts the conversation. And then this conversation just gets bigger and bigger to talk about, like, well, what else do we need to work on? Because we know Narcan is only after someone overdoses. Right. What else do we need to work on to prevent that overdose to begin with? And that's the real conversation I want to have. That's where I get really excited, because there's so much we can do to prevent overdoses.
Right, exactly. And so I'm going to put a pause on that one for you today.
Yeah.
Because there's some other things I think that you have a voice and a perspective on that would be super valuable. And one of them is, okay, let's say you have an overdose at your home, you have Narcan, and then the emergency room.
Yes. So once you're at that level of either overdose and then Narcan, and now you have to go to the emergency room, or someone's just in a crisis because they're having severe withdrawal from a substance, whether that's opioids, alcohol, methamphetamines, et cetera. With Narcan, we're talking just about opioids, but we have to realize that there's different substances in people's lives. Sometimes people need to go to the emergency room. And no one ever plans that. It's not in your calendar. You look on anyone's calendar, no matter if they're a CEO or a janitor, no one says, go to the ER today. So it's never planned. And that adds stress to everyone's life. And in the life of an addicted person, that extra stress can be very traumatic. So I think we need to reflect and recognize that. And really, that's where, the person-centered approach really just sees that, here's a person that's going to need extra help. They're going to need extra support, and we need to prepare them to go into a system that may or may not, be ready to handle them. Where I work, our emergency departments are super busy. And unfortunately, they may be actively like resuscitating someone, or you just have just a lot of people in line with the cough, the cold, the flu, and then you're going to have to wait just because that's how the numbers work. So the waiting can be very, very hard, especially during the wintertime, just because that's when these surges happen in our healthcare systems. And also people, they may not have as many doors to walk into because you have wintertime hours, and you have a lot of urgent cares and primary care doctors. They're taking their time off, et cetera. So you don't have as many doors to walk into, which also forces more people into emergency services. So be prepared for that. Going to the ED in the wintertime can be a little bit harder. You may have to plan your schedule. You can basically bet that the afternoon is going to be busier than the early morning, that the weekdays are going to be busier than the weekends. And so you can kind of, if you do have the freedom to plan a visit, then you can kind of work that into how you decide to go in. Obviously, if someone's having an emergency, they're having an emergency and you need to go in right away. But what I see is on the low acuity side in my emergency department, people who just need, a clinic referral, people who just need a quick outpatient prescription that we're able to facilitate very quickly. But, if they have to wait in line for 2 hours, even to see me as a clinician, then that's going to add to their stress level. So that's where, knowing ahead of time, who are my local resources? If I work with an addiction medicine clinic, make sure that you have their after hours plan. Who do I call after hours just in case? What if I run out of my prescription medication that I use? In our emergency department, we really support people that are on MAT, medication assisted treatment, with something called buprenorphine, also branded as Suboxone, but it's basically a generic version of Suboxone. So that's basically, we want to make sure that we patch people through until they get to their medical home. in an addiction medicine clinic or even a primary care clinic. And so we don't want them to be left out in the cold, literally and figuratively, when it comes to prescriptions. So just working with your whatever resources you have, whatever you've worked in the past, whatever you've used in the past that's worked for you, make sure that you have a good plan and contingency plans going into a crisis.
Yeah. So one thing I do absolutely want to speak to is friends and family, because you may be at a party and somebody overdoses and Narcan, great. And then go to the hospital with your friend or your family member. How do you, as a friend or a family member, advocate in a calm and kind of measured way to get the help for your friend or family member that is necessary? So who do you need to be?
You may need to be the adult in the room, you know, because you're the one that has the most perspective, and you may need to be the calm voice of reason in the room because everyone else is overreacting. The patient themselves, who's your loved one, may not be in a state, they may not be in their best self. So they may be overreacting to whatever stress they're dealing with. And then the healthcare providers may not have the contact to really understand what your loved one's needs are. So you have to be that calm voice of reason to say, we've been here before. The metaphor that I love is, you know, you have to be the pilot through the turbulence.
Yeah.
And if you're the pilot freaking out because of a little bit of turbulence, then everyone on the flight is in danger. So you have to understand turbulence is turbulence, and any crisis can be averted or solved, but you have to stay calm through those moments. And you have to be that calm voice of reason because everybody else on the plane may be going crazy. So yeah, you know, I think we've all been there. For those of us that have loved ones in our lives or patients in our lives that need our support during that time. And so you may be there again. Just be prepared for that moment and say, okay, this is where I'm called to be the rational adult in the room so I can advocate for my loved one and we can both get out of here faster. You know, honestly, so much of this is just really self-serving in that way, because the more calm communication you can facilitate, the more efficient the care will be. And then everyone gets to go home faster rather than, you know, just making the problem worse and worse. And then you don't get the help that you need. So then you're either left unhappy or you're going back in because you didn't get the help that you needed to begin with. So yeah, that's where really just prepare your mind to be in that state where if you are being called to advocate and support a loved one during an ED visit, write things down. That carries so much weight. Let me tell you, as a clinician, if someone takes the time to just write down in their own handwriting, doesn't have to be typed up or anything, but just if you just have a full list of, here's my person's medical issues, here's their allergies, here's their medications, and here's the doses, that helps so much.
Right.
That helps so much because, you know, while it is true that everyone's medical record is typed in a file somewhere and everyone on the care team has access to it, we live in a blizzard of information. That blizzard of information is really hard to navigate for complicated patients. So as a clinician, I always appreciate when family members have everything written out in a nice, clean way. And you don't have to disclose like your entire life history or super sensitive information, but you should have like the pertinence, like here, for this crisis, this is what works for my friend or family member. And here you go. And now the triage nurse will see it. Then the next person will see it. Then the next person will see it. And then you don't feel like you have to tell the story 20 times, which is also very frustrating. I mean, patients tell me this all the time. Like, I just told the last guy 5 minutes ago, go look in my chart. And guess what? The last guy has not had time to type it into the chart yet. And so that's why I have to come to you and ask you those questions.
Right.
It's frustrating for everyone.
Right.
So if you just have things just written on an index card, you know, it doesn't take too long, but that will do a world of good for you and for your loved one, is just to write down just some quick notations about their medical issues and what you feel like would be best for them. You know, you're not ordering things, you're not becoming the doctor, but you are creating a toolkit that's very, very helpful for the care team during that crisis.
That is a fantastic suggestion. Thank you for that.
Sure.
So let's shift just a little bit more. I've also had several execs that one in particular had an employee have an accident at work. And the woman who had the accident needed emergency care and had been clean and sober for like 2 years. And her family pleaded with the hospital, please do not give her fentanyl. And they did. And so, you know, there's the advocate piece of this, but what's the alternatives? are recovering from fentanyl addiction or opioid
Yes.
addiction, and you have an accident or, what do you do?
Yeah, great question. Wow, there's so much to unpack there. So in general, as a clinician, we definitely try to honor people's wishes whenever it comes to if they do not want a certain class of medications. Sometimes there's just rules around, like if they're in a recovery program and then basically they're not allowed to have a certain class of medications, et cetera. We do try to honor that because we appreciate, how disruptive it can be whenever that gets really messed up. And then that makes the patient recovery kind of slide back. The good news is there's a whole field opening up called ALTO. And ALTO stands for Alternatives to Opioids. ALTO, ALTO, which is also the Spanish word for stop, which is very clever. But basically, ALTO is basically saying, you know what? We need to decrease or stop the exposure to opioids, especially in our vulnerable patients. And ALTO is this whole field of medical research and education, which is really trying to push for this message. And really, we do whole lectures on ALTO. We do whole CME activities about it. We really want more and more doctors to be aware of this movement because we really feel like this is another, like I said, this is another pillar in confronting the opioid epidemic.
Right.
Is to say, let's not use opioids when something else will do. And there's a lot of different alternatives. So for that patient, for example, if fentanyl was not appropriate, they could have had something that was a non-narcotic. And again, I don't think we're in the business of giving medical advice on this program, but there's just in general, there's different classes of medications. There's non-narcotic medications that can help with inflammation. So there's anti-inflammatories like NSAIDs. There's also medications that can kind of like work on the nerves because so much of this is like just sensory and nervous system dysfunction. And so if you can just kind of calm down the nerves with certain medications that are, not, again, non-narcotic, not as sedating, not as addictive, maybe safer, especially in someone who's vulnerable to opioid use disorder. Those are the kinds of medications that we use. And then there's really new stuff that's coming out like ketamine, which again, ketamine always gets the headlines when it gets abused or misused. It turns out ketamine actually has a lot of utility as for pain, chronic pain. We use it, even for what we call conscious sedation procedures, which is basically, you're putting a fracture back together or you're putting a dislocated shoulder back into its socket. And you really have to kind of knock the patient out, but you want them to keep breathing. Ketamine is actually a very useful medication. So it ends up, there's a lot of different medications that are not narcotics that can be used in that space. But again, it just closed loop communication, and really advocating to make sure that that patient does not get those medications if that's what your wishes are. And then really making sure that the team explores all the other avenues. And that's, again, on us as clinicians, as we're trying to do as much as we can to educate our emergency folks. And I think most emergency doctors are pretty excited about this. This is something that they've really kind of embraced. And even if they're not toxicologists or addiction medicine specialists, they can really do a lot outside of the narcotic sphere to help treat people's pain. We're getting better and better at ultrasound year after year. We can literally like find your nerves on the ultrasound and then do ultrasound guided nerve block, which are really neat. And those nerve blocks are using things like lidocaine, which are, basically they're just the same thing that your dentist uses whenever they're numbing up your mouth for the dental work. So ALTO, it's a big topic. There's a lot going on with ALTO. There's a lot of research that still needs to be done. But that patient advocacy piece is something else that's really going to drive progress in that field. And just know that, don't lose hope. Just because you don't have access to opioids or because you want to minimize your exposure to opioids, the good news is there's a lot of other strategies out there to help control people's pain. And we all need to get on board about how to make that happen in real time.
Yeah. And so does this, what you've just said, also help with needing surgery?
It can. I mean, there's some just amazing stuff. I went back and started looking at Bill Moyers. Bill Moyers back in the, I think, 90s had this amazing book called Healing in the Mind. And basically, he was just trying to make these connections even back then to say, what can we do to really harness the power of the brain to facilitate healing? And he's got this amazing chapter where this lady, I think he goes to China and the lady gets like a whole neurosurgery with acupuncture. And you're like, oh my gosh, that's amazing.
Right.
So your question is, how could we facilitate surgery with some of these techniques? Certainly, I mean, I don't know anyone that's doing acupuncture or surgery, so I don't want to misrepresent what that was. But I think that there are like amazing examples of people getting like really big surgeries without using opioids. And the example that comes to mind for me is that last one, the ultrasound guided. You can pretty much deaden like the whole extremity. You can really take away the nerve reactions for, a few minutes to a few hours for the whole extremity, and then just do a lot of different surgeries and stuff. So sometimes if somebody I don't do it, I'm an ER doctor, you don't want me in the operating room, but basically as an ER doctor, if I have to do like a lot of stitches in an arm, for example, and I don't want to numb up the arm bit by bit with little pokes, we can actually just deaden the whole arm with a nerve block that serves the whole extremity, which is amazing when you think about it. I mean,
absolutely
that's a small medical miracle.
Right.
So that's the kind of thing that we're talking about. Same thing with the conscious sedation, with ketamine. There's other things that are also being deployed. It just depends on, what your local emergency room or surgical center is equipped to do. And certainly as a patient, you have absolutely the right and the responsibility to know exactly what they're going to do. So that you know exactly what tools they're going to use. And basically that informed consent process allows you to ask questions to say, okay, thank you for sharing this plan. How is it going to honor my request that opioids not be used? And then really ask those questions, and hopefully your provider will respect that kind of a question and have a good answer for you. So I would say that's completely appropriate during the informed consent process is, everyone deserves that. And it's required in the medical field that we tell you exactly what medications we're going to give and how we're going to do the procedure. And that's the time to really go in and ask those kinds of questions.
Great. Okay, super. So we have more power and a voice than I think some people think.
For sure.
And to be informed and to know how to use your voice and speak up and ask for what you need is super, super important. So one thing I did want to touch on too is, since it's been months since we talked, is what are some of the trends that you're seeing that are beginning, to get more traction, like the alto that you were talking about, that you're beginning to see getting more traction so what trends are you seeing?
So there's a couple that I can tell you off the bat. So during the pandemic, one thing that was always around, but that got a lot worse and that we don't talk enough about is alcohol, and people struggling with alcohol, either in combination with opioids and other issues or in isolation. This is just a big, almost invisible epidemic, right? I mean, all of us know someone who's struggling with alcohol. And I think that there's a little bit of nihilism here because people think, oh, well, you can't do anything about it. It's incurable. It may be genetic, et cetera. And none of that is really aligning with the evidence that we now have, that regardless of what the roots of it are, there's definitely things we can do. There's definitely both counseling and medications that work really well. And you may not turn an alcoholic into like a totally dry, sober person, but what you can do is get them to drink less, and really and decrease their behavior to where they're out of the problem zone, even if it's most days out of the week. I mean, think about that. I mean, any little progress is going to build on itself, and we really have to chip away instead of asking for drastic like sobriety the next day. I think we kind of push ourselves to put the stakes too high, and then we wonder why we're failing. And I always just say, well, let's lower the stakes and just get incremental change. And that's kind of where we are with alcoholism, is to say alcohol use disorder. There's definitely medications that are generic, very inexpensive, that are showing a lot of evidence. And, you can talk to an addiction specialist, even a primary care doctor, about starting on those medications. And if you're someone that's drinking 6 to 10 drinks at a time, maybe you'll go down. Maybe you may not stop, but maybe you'll go down. And even that, it's like, that's harm reduction. That's exactly what ideally, we would get everyone to stop drinking all the time, especially those that are at risk. But we understand that in a realistic world, that's not possible for everyone. So let's do harm reduction and really just decrease the number of drinks. And some of these medications are really helping with that. And other people are finding even more benefit, and they really do get sober. And that's wonderful to see. So don't give up on your alcoholic loved ones, people that are struggling with that, because there's a lot of progress in that space. And it doesn't all have to be just a single cookie cutter program, whether it's a 12-step program or whatever. Not one size fits all with this disease.
Yeah.
It's actually probably many different diseases that we all just call one label, which does a disservice to all the people that are suffering from it. But there's a lot of different strategies, and we can do nothing. I think nihilism is no longer an option for alcoholism.
Right.
Knowing what we know about how bad things are and how better they could be if we just did a few simple interventions.
Yeah.
So that's one trend that I'd love to see really take off in the new year, is to say the same amount of energy that we're expending on opioids, which is very, very important. Let's do the same thing with alcoholism. Another one is nitrous oxide and inhalant. So this is something that, again, a lot of people don't know, but a lot of young people are struggling with this. So when we say inhalants, we mean anything that, where the vapor can actually cause an intoxication state. So it could be spray paint, it could be duster spray, the list goes on and on and on. And unfortunately, they're widely available. You can go buy them at the retail store, et cetera. It's very unfortunate, but it's something that, I do see as a toxicologist. I hear about it through my work at the Poison Control Center. We're seeing it at the public health side, and just letting people be aware, that there's different substances out there that you may not even consider a drug can get people into trouble. And so that's another trend that, again, as long as you're watching and looking for these things, you could probably intervene early, and you can probably support someone who's struggling, because chances are they're self-medicating for some other issue.
Right.
Depression, anxiety, ADHD, you name it. So then you can get them help for whatever issue that is that they're self-medicating with something that's not going to be harmful for them.
Absolutely. So let's shift just a little bit in the time that we have left and talk about root cause.
Yeah, so that's a big topic. Thank you again for, you always bring this larger human dimension to this. That's why I love these conversations. I think root cause is something that we really need to just ground all of our conversations into asking, how do we go upstream? How do we go upstream? We started this conversation with Narcan, and that's great. But, I think I get frustrated when people think that that's the end of the conversation.
Right.
Because that's like the most downstream. It's still life-saving, but that's like the most downstream intervention you could think of, is like the person has already stopped breathing, the car crash has already happened. So let's prevent all of that stuff. And that's where the root causes is like the most upstream thing we can do. We know addiction starts very early. Many people have said addiction is an adolescent disease. And that, it's our teenagers and adolescents that are really struggling with their childhood experiences and with their young adult experiences are just learning these behaviors that then go on to harden into life-threatening medical addictions. And so that should give us great pause, because, it's like, how much are we really doing to educate our teenagers? How much are we really doing to protect them while they're making their way in the world and trying to learn how to be adult? Really, when you talk about root causes, all of us need to do some reflection on, what are the habits that we learned? What are the defense mechanisms that we developed? And are they still serving us? Or are they just shortcut because we're trying to avoid something painful? And these shortcuts are now counterproductive. I define any addiction can be really seen as a counterproductive shortcut. Whether you're just trying to short circuit your pain, short circuit your boredom, short circuit your social anxiety, whatever you have. And if you're not working through the really hard work that it takes to work that out, then you're going to get in trouble with a substance. And it may not even be a substance. It may just be a behavior, and that's where whenever I studied for my addiction medicine boards, the way that they teach the neuroscience of addiction is it's the same circuits as like gambling, behavior addictions. Let's throw screen time and compulsive shopping,
workaholism,
workaholism, addiction to success, addiction to recognition. It's the same kind of, dopamine circuits in our brain that we basically learn these shortcuts because we're afraid of the pain of working through things in an honest way.
Right.
So that's where, talking about root causes, I wish I had the answer. I think that we're asking good questions. I wish I had the answer in the skill set to help everyone that I know, including myself, to work through some of these root causes. I just identify them. I just see this as like these massive trends in our society where, we're just tempted all the time, right? We're tempted all the time.
Right.
To that one-click shopping, that one-click shopping culture that we have. is
Yeah.
really for everything. And if you're having a bad conversation with someone, guess what? Hang up and ghost them, instead of actually working through
Working
those
it
difficult
through.
emotions.
Yep. Yeah.
Right. So
Exactly.
and we're all guilty of it to some extent. So, I think as a society, we need to work out better skills and better mechanisms and strategies to cope whenever things are hard.
Well, I mean, I meet with so many people, and I mean, I'm consistently in front of CEOs and C-suite execs,
Mm.
and almost to a person,
Yeah.
they have had trauma in their childhood. Um,
Oh, interesting. Yeah.
yeah, it's amazing, and so based on how old they are and whether they want to take it on. I mean, however, I see alcoholism, addiction, workaholism, so on and so forth, as the huge red flag of I've got pain.
That's massive. Wow. Thank you for saying it out loud, because that's something that I think all of us see and feel, and no one in organizational culture ever talks about it. No organizational culture ever talks about it. We talk about wellness, we talk about work-life balance, but also please send us all of your recognitions and awards so
Right.
that we can put you up as a trophy,
Yeah.
And it's like,
Yeah.
well, which is it? Because again, that rewarding people for success only drives, the system delivers what it's designed to deliver, right? And if all you're delivering is recognition of people for succeeding at all costs, then guess
Right.
what?
Yeah.
You're going to deliver these broken,
Right.
little shiny medals.
Yes. Yes, exactly. I mean,
Yeah.
obviously, this is a meta discussion.
No, it's great. I think
yeah.
about it at this level a lot. I really do.
And so, I just see it almost on a daily basis. And I mean, I'm thinking of one exec in particular who came to me for leadership coaching, and I had him do a couple assessments. And then about 15 minutes in the first conversation, I said to him, kind of based on what showed up in the assessment, can I ask you a personal question? And he's like, sure. And I said, did you experience childhood trauma? And he looked at me and he's like, basically, how did you know?
Right. Yeah.
And I'm like, well, most people do, for one thing, but based on what showed up in your assessments, I had a pretty good idea. And also because, I have my TED Talk and it's on my LinkedIn profile, he had listened to it, in which I'm completely vulnerable about my experience with my son's addiction. And so then it gave him permission to tell me about his childhood issues with his parents, being kicked out at 11, on and on and on. And this is a very successful C-suite exec. And I think my experience is that most of them are walking around with trauma and pain, and they don't have a place to express, deal with it, and expunge it. And so we have created all these really self-destructive and dysfunctional ways, keeping the pain at bay until it no longer be at bay.
And control. I mean, this is where the culture of control comes from, and I talk to people that want to do the work of treating people with addiction. They want to start X, Y, or Z medication, or they want to start this intervention, or they want to just focus on this population. And it's like they just hit a wall. It's like, I can't get through this department. I can't get through my upper levels, or I can't get through my organization. What am I missing here? There's so much evidence. We know this is going to help our patients. What am I missing? Why are these control people just blocking me? And my answer to that is, before you help a single person that's addicted to drugs, you have to engage this whole culture that's addicted to control.
Yeah.
And it's the same dynamic. I mean, you still have to do harm reduction, and you have to wrest control a little bit at a time, knowing that people are going to freak out a little bit, not in a way that makes things unsafe or disruptive, but you have to understand that that's their dynamic, and that control, that addiction to control that people sometimes express is serving a purpose in that person's psychology, and I think that links very well to what you just said is a lot of these people that succeed in organizations are really, haunted by ghosts in their past.
For sure.
And this is how they know, this is the only thing they know of how to keep those ghosts at bay.
Right. Woo. Okay.
Wow. I love talking with you, Kale. I mean, it's always like, we're going to have this journey and move to a totally different place. But it's very insightful. It's very profound.
Absolutely. So I so appreciate you willing to play at all
course.
different levels. And I mean, you are absolutely a change agent and a seeker of the truth as an evolution of how you operate in the world. And so, I hold you in very high regard. And I'm so grateful for the work that you do in your community and in the state of California. I wish we had one of you over here.
Well, thank you. I mean, the feeling's mutual. Your message is getting out to, the whole universe. So thank you for the courage that you show and the role modeling that you display every time you come on camera and talk about your experience. The feeling's mutual. I really admire all that you do, and I really respect it. So thank you for the opportunity.
Thank you. Absolutely. So we'll let you go. I know you've got to get to the emergency room, and just want to say again, thank you so much. I hope that there were a lot of takeaways for our audience today, which I can only imagine there were. And I look forward to the next time we have a conversation, and we'll be talking about some different things then. So
same here. Happy holidays.
Yeah.
Have a joyful and lovely Christmas and a happy New Year. And I hope everyone out there is able to stay safe. Plan a little bit, prepare a little bit, make a little bit of a note card, just on a little note card, and that will help a tremendous amount along with that Narcan. So hopefully we gave people lots of good tips for today, and I hope that really helps people.
Yeah. Okay. Happy holidays.
Thank you.
Thank you.
Take care.
All right.
Take care.
Bye-bye.
Thank you. Bye.
I just want to say I'm so deeply grateful for Dr. Rais Vohra being in this world, for one thing, for the work that he's doing, for the insights that he gave us today. Very actionable, very important things to be thinking about. And so I hope you took some notes and you took away some things that really will matter in your life and the lives of your loved ones or your friends. And join me in thanking Dr. Vohra for an enlightening and important and compassionate conversation that we had today. And happy holidays, everybody.